Manual muscle test, supraspinatus. The action of the supraspinatus is shoulder abduction in the frontal plane along the anterior-posterior axis. The origin of the supraspinatus is the supraspinous process, and the insertion is the superior and middle facet of the greater tubercle. Have your partner sit on the mat table and move into shoulder scaption. Place one hand on the shoulder for stability and the other on the distal humerus. Have the partner resist upward into shoulder abduction as you press down into shoulder adduction. She gets a 5. Manual muscle test, hip internal rotation. The prime mover in hip internal rotation is the glute minimus that moves in the transverse plane along the longitudinal axis. The origin of the glute minimus is the iliac crest, and the insertion is the greater tubercle. Have your partner sitting on the edge of the mat table and move their hip into internal rotation. Place one hand on the medial aspect of the knee and the other on the lateral malleolus of the ankle. Have the partner resist your motion. Apply pressure going into external rotation, and they're going to resist into internal rotation. She gets a 5. Manual muscle test, obliques. The action of the obliques is trunk flexion in the sagittal plane along the medial lateral axis and lateral bending in the frontal plane along the anterior posterior axis. The origin of the obliques is the thoracolumbar fascia and the iliac crest. The insertion is the linea alba, pubic crest, and ribs 9 through 12. Have your partner laying supine on the table and with their hands behind their head. Instruct them to flex and rotate to one side. If their inferior angle of their scapula comes off the table, that is a grade 5. Have them then cross their hands in front of their chest and repeat the same motion. If they can do that, then that is a grade 4. And if they can't do that, then have them extend their arms straight out in front and perform the same action, and that is a grade 3. She got a grade 5. Range of motion, wrist flexion. Wrist flexion occurs due to the flexor carpi radialis, the flexor carpi ulnaris, and the palmaris longus working in the sagittal plane along the medial lateral axis. Have your partner starting in a sitting position with their arm propped up on the mat table. The axis of rotation will be the triquetrum. Have the stationary arm parallel to the ulna and the mobile arm parallel with the metacarpal. Have your partner perform wrist flexion. The partner was able to achieve 80 degrees of wrist flexion, and a normal is an 85. Range of motion test, hip external rotation. Hip external rotation occurs primarily due to the gluteus maximus in the transverse plane along the longitudinal axis. To measure this, have your partner sitting on the mat table, and the axis of rotation will be the anterior patella, with the stationary arm staying perpendicular to the floor and the mobile arm moving along the anterior aspect of the tibia. Instruct your partner to externally rotate at the hip. She was able to perform 30 degrees of hip external rotation. Hip external rotation's normal is 45. Range of motion, cervical rotation. Cervical rotation occurs primarily due to the sternocleidomastoid. Have your partner sitting on the mat table. The axis of rotation will be the middle of the skull. The stationary arm will stay in line with the tip of the nose. The stationary arm will be parallel to the acromion, and the mobile arm will align with the tip of the nose. Have your partner perform cervical rotation. She was able to perform 87 degrees of cervical rotation. The normal is 80.